Good morning, ladies and gentlemen, and welcome to the Healthcare Strategy and Plan Design Press Briefing Call. At this time, all participants will be in listen-only mode. If anyone should require assistance during the conference, please press star and the number 0 on the telephone keypad. I would now like to turn the conference over to your host, Mr. Brian Marcotte. You may begin the call, sir.
Great, thank you, and welcome everyone. My name is Brian Marcotte. I'm the President and CEO of the National Business Group on Health, and with me is Kelsay, our Chief Strategy Officer. And I want to welcome you to this briefing of our 2020 Healthcare Strategy and Plan Design Survey findings. We have a room full of journalists here, and this is a press briefing. We also have a number of our members dialing in. We had as many as 700 registrants for this call, and so we'll see as they trickle in over the next few minutes or so. Because this is a press briefing, we're going to limit questions to press in the room or on the phone. We do have some press on the phone as well, I believe. If you do have a question for the press in the room, you have to use your microphone so everyone else can hear. Just press the button. You need to speak directly into the mics because these are not multi-directional microphones. If you go off to the side, people aren't going to hear you. So just keep that in mind as we get to Q&A. We're doing this a little differently this year. This is a different format than what we've done in the past. For those of you who have been with us before, we typically do this at the press room in D.C., and that's usually on C-SPAN and sometimes Fox Films as well, and it limits our ability to how we share information. It ends up being just a narrative of me standing up there and just talking about what the results are. We wanted to make it more visual, make it more interactive, and so we decided to have the meeting here in our offices and share slides and go through the data in a little bit more detail and go a little deeper on some of the implications of the information. So we're looking for it to be more interactive, although we're looking to have more questions held to the end to make sure we get through the data. But at the end, we definitely want to do more Q&A. For those of you who don't know the business group as well, the business group is a membership-based nonprofit organization that is made up of primarily large, self-insured, multi-state, in many cases global employers. We have over 440 members, and our focus is really to keep our members on the leading edge of thought, innovation, and action to address the financing, the delivery, the consumer experience, the affordability of the healthcare delivery system, but also to accelerate the adoption of innovation and to improve the health and well-being of the global workforce. That's who we do. We convene employers in a number of different ways to drive that agenda. And we survey, this is our largest survey we do every year. And I'm going to take you through some of an overview of the survey and how we structured the survey, and then give you a highlight of some of the key insights from the survey, and then Ellen's going to walk you through the details of the survey, and the two of us will provide some color commentary along the way. So about the survey, we always field the survey in the May-June timeframe because most employers finalize their decision for the upcoming year at that point. And why that's significant is because the survey ends up being about what employers will do in 2020, not what they're considering for 2020. Because by the end of June, typically your decisions are finalized for the upcoming year. 147 large employers participated in the survey, covering over 15 million employees and their families. And something we started last year was to go beyond the benchmarking on plan design, on healthcare cost, on employer initiatives, which are always important in always telling in terms of trends. But we started asking employers to reflect on what is trending in the market and get their views and their perspectives on those issues. So we have questions in this year's survey around Medicare for all and Medicare expansion. We have questions in here around high-cost drug therapies that have emerged in the market. We have questions on virtual care, which continues to proliferate in this country, and employers implementing more and more solutions. We have questions on local market initiatives and alternative delivery models. So there's more than just the benchmarking data, and those questions have a tendency to change year to year based on what we're seeing trending. The other thing we did differently this year is we did interviews with 7 employers across a number of different industries, focused on the issues here on the right hand of the slide, trying to add a little more of their color into the report. And their remarks and comments are woven throughout the report. And if you don't have that report yet, you can easily download it off our website. It's out there now. So just a little bit about the respondents. This cuts across just about every industry sector. You can see the breakout on the left-hand side. And these are large employers. Over 70% of the respondents have more than 10,000 employees, and many of them are global. The majority of the people who responded to the survey are in global companies as well. So as we think about some of the key insights out of the survey for 2020, I'm going to walk through at a high level, and this is where Ellen's going to go into more detail in just a few minutes. We continue to see healthcare strategy as a growing integral part of an employer's workforce strategy. We started asking this question last year, and we asked it again this year to see how that's changing. And Ellen's going to walk into some of the data around that. But what we're seeing is companies are making more investments in the health and well-being of their employees. And the way I think of it is they're looking at investments in health and well-being much in the way that they look at investments in training and development and safety within their organization. It's not just about healthcare for healthcare cost. It's about trying to produce the most productive, engaged workforce possible. And so you'll see some data on that. As employers have moved beyond just focused on physical health in their organizations and looking more at holistic well-being and look at emotional well-being and implementing resources to support financial well-being, social connectedness, connections with the community, employers are more and more focused on social determinants of health and the role that plays, even more so than biology and even the health care you receive in determining your health status. And so we're going to show you some data on what employers are doing around social determinants. Yeah, when it comes to the political discussions around Medicare for all and Medicare expansion, employers have significant reservations about Medicare for all, and we'll get into some of that data and some of the reasons why. And they're a bit split on Medicare expansion, and we'll talk about that as well. Virtual solutions, I mentioned earlier, continue to proliferate in the market. Employers see them as playing a big role in how healthcare will be delivered in the future. We're going to show you some of that data and where are some of those opportunities that are emerging for virtual solutions going forward. And as employers, healthcare is local. Healthcare is locally delivered. And although most of our members are multi-state employers, they're beginning to turn to local market initiatives to try to have an impact on how healthcare is being delivered. And one of the areas is around advanced primary care strategies, and we'll spend some time talking about that. Now, employers spent a number of years, moving to high deductible plans, putting in transparency tools and other resources to help create more of a engaged consumer. And I think the reality is that, and what we've learned from that experience is that the delivery system is just way too complicated, and employees and consumers do not touch the delivery system with enough frequency to ever be sophisticated consumers. So we've been seeing this shift over the last couple of years to try to simplify the consumer experience and help navigate them through. So we'll share some of that data with you in what's really trending and supporting the consumer's experience. Healthcare costs are expected to top $15,000 per employee in 2020. Healthcare trend continues to run higher than general inflation. We'll share some of that data and some of the drivers there as well. And as we look at plan design, employees can expect very little in the way of plan design changes for 2020. When you look at deductibles and you look at coinsurance, you look at HSA contributions and some of the other elements, the other levers within plan design, we're not seeing much change at all in those key drivers of plan design as we look to 2020. And then when it comes to high-cost drug therapies, employers are very concerned about the impact on not just the pharmacy benefit, but also their total cost of care. The latest drug is probably tip of the iceberg that came out in May, Zolgensma, for spinal atrophy, spinal muscle atrophy, thank you. And it cost over $2 million per treatment. So how we finance these going forward, there's a lot of, this is new territory for employers. How do you finance these drugs? We'll talk about some of the insights we've garnered, not just from the survey, but also in talking with employers about what do you do about these on a go-forward basis. So those are just some high-level thoughts to kind of set the stage for what's to come. I'm going to turn it over to Ellen, who's going to start walking us through some of the data behind these insights.
Great. Thank you, Brian, and welcome to all of you here in the room, as well as all of you on the phone and following along online. As Brian did mention, those were the top 10 insights. We distilled the bulk of the survey findings down to those 10. We do have many other insights in the survey report itself. Those of you in the room should have it in front of you. Those of you following along online can download the full report as well as the chart packs and press release from our website. So certainly encourage you to do that. And it is my pleasure now to expand upon and dive deeper into those key insights that Brian just shared with you by providing much more detail around the actual survey findings themselves. So starting with the first one around healthcare as a key aspect of an employer's overall workforce strategy. This is the second year in a row that we've asked this question, and we have seen increased growth from last year to this year in the number of large employers who view healthcare strategy as an integral component of their overall workforce strategy, up 9 points year over year. And essentially what this means is that employers view healthcare and the investments that they make in the health and well-being of their employees as essential to hiring and engaging an engaged workforce, a productive workforce, and ultimately, hopefully, a workforce that contributes to that organization's bottom line and their overall business performance. So employers are making investments not just for the sake of health and managing healthcare costs, but ultimately because they fundamentally believe that that is the right thing to do for the people that they employ, for their family members, and that it does have an impact on the overall organization's performance. We saw a decline year over year from 20 to 15% of employers who make investments in healthcare really just for the sake of managing healthcare costs. So that's a good thing. I think if we had asked that question a number of years ago, that number would have been much higher. Employers were looking at healthcare really for the sake of healthcare and not looking at its correlation on impact relative to workforce and workforce productivity and engagement. So a trend that we're going to continue to track year over year and continue to see growth in that top line number of it being an integral component of an employer's overall workforce strategy. Building off of that, because employers do see healthcare as an integral component of their workforce strategy, they're also increasingly playing an activist role. We reported on this for the first time last year. I wanted to call your attention to the items highlighted here in the blue box at the top of the slide. These are the two notable changes we saw year over year from last year to this year. First, the number of employers that are taking a wait-and-see approach has declined from 19% down to 12%. Simply put, employers realize they can't just take a back seat and wait. They need to roll up their sleeves and dive in and be an active participant in what's going on within the healthcare ecosystem. The shift in that 9% was attributable to growth in the number of employers who are partnering with health plans, PBMs, and other partners. So taking a deferring to their partner approach, up 32 to 41% in this year's survey. And we really think that this is attributable to a number of reasons. One, employers quite honestly are frustrated with the slow pace of change and are looking to their partners and collaborating with their partners to drive change and drive innovation. And others because, quite honestly, most employers just don't have the bandwidth to drive that kind of change on their own. As Brian mentioned, many of our members are multi-state, and to drive change in each of the locations that they operate with health systems or partners in each of those locales may be really challenging to do. So they're going to rely upon their health plan and other partners to help them navigate and see change. Another area is that many employers are looking for a way to streamline and consolidate their offerings. just the ecosystem of solutions that employers have today and that they offer to their employees and covered family members is just far too extensive. And so they're looking for traditional partners such as their health plans to help aggregate and navigate and communicate those solutions to their covered family members. The bottom half of this slide, we really saw no change year over year, and that's about 49% in total there at the bottom of employers who are also driving change through looking at things like accountable care organizations, high-performance networks, centers of excellence, as well as digital care solutions that Brian had mentioned previously as well.
You know, one other area that employers are looking to partner with their partners on is the area of high-cost drug therapies and trying to figure out how do you finance these and how do you manage these. And so I think that's an area that employers need to look at their PBMs, need to look at their health plans, and just start working with them to figure out solutions to manage those. So that's another reason I think why that number is up this year.
Brian spoke to social determinants of health in his opening comments, and this is the first time we asked this question. And increasingly, as employers are looking at their workforce and the health of their workforce, they're not just looking at what happens in the confines of the office or work environment, but also what that means for employees outside of the work environment. And when we talk about social determinants of health, we really mean a number of different things that impact an individual's life, just generally speaking, both in and outside of work. And they could be things such as financial, economic situations that individuals confronted with, their health care access, as well as health care literacy, education, food quality access, housing, transportation, as well as crime. And so when we asked this question this year, we were pleased to see the number of employers who are actually focused on these social determinants of health and how they impact an individual, with the majority looking at financial and economic, followed closely by healthcare access and literacy. When you think about financial and economic resources, the types of things that employers are doing to assist employees in that area could be things such as financial planning. That's not necessarily new. But a lot of employers are also doing a lot around the areas of budgeting and just budgeting fundamentals, helping employees with wages and how to balance kind of day-to-day living expenses. They're also looking at things such as tuition reimbursement and loan forgiveness. In the areas of food quality, we see a number of employers do things such as offer food pharmacies. They're also looking at the food and quality and cost of food that they provide in the work site, so not only in the vending machines but also within their cafeterias, and making healthy food options in their cafeterias the more affordable food options to really encourage employees to proceed with those types of food options at the work site as well. Around the area of housing, an interesting correlation we saw is that those who live in at-risk areas generally tend to have a much greater risk of use of the ER, not only twice more likely to use the ER, but often use the ER multiple times in the course of a year. So employers are really doing a lot to look at housing and making sure that employees feel that they can, seek care in other avenues as well. Anything else on social determinants you wanted to add?
No, just a comment on, you'll see through the report employee voices on a couple of areas. And we pulled data from a survey that we did with Optum earlier this year to bring in the employee perspective on some of these. So you look at social determinants, you can see that employees are interested in support on healthcare prescription costs and housing, as well as transportation expenses. So there are other, you look at what employers are doing and you look at what the need of employees are in terms of what they're saying they need, and you start to see in some areas overlap, in some areas gaps. And I think that the combination of the data can help employers figure out what do they need to target next. And so you'll see that throughout the survey, certain spots, this employee voice will also be raised to balance the views of the employer.
All right. Again, Brian teed this up, but we did ask this question around both Medicare for All as well as Medicare expansion. Obviously, there's been no shortage of discussion on both of those topics on the national stage. We thought it was an opportune time to ask our members about their views on both of those matters. And here you'll see that employers do have significant reservations about Medicare for All. 72% do believe that it will decrease the number of uninsured in the country, although that was followed by a number of concerns they have about the Medicare for All proposals, including areas such as increased health care costs for employees, leading to a reduction in overall health care quality. Also, they believe it will lead to an increase in overall cost within the healthcare system at large for all parties. 69% believe it will stifle healthcare innovation, and then 81% believe that it will lead to an increase in taxes. We believe that this is for a number of reasons. First, it's not a surprise that the private employer-sponsored market does quite a bit to provide subsidization to the public or government-funded healthcare programs. And also, the private market drives a lot of innovation within the healthcare delivery system today at large. Also wanted to note here that I think a lot of the concern related to the Medicare for All proposal is that many of the proposals are lacking detail. And so without specificity and understanding how these proposals would all come together, I think there's just quite a lot of concern about employers and the devil in the details about whether these proposals would actually lead to an improvement in cost, quality, and outcomes for covered family members.
Yeah, I think there's a couple of other areas as well. Most of the proposals focus primarily on access and how to provide universal coverage, which universal coverage is important, but they need to focus on how healthcare is going to be delivered. We know there's 30% waste in the system. Many of these proposals don't even discuss at this point how they will improve the efficiencies within the delivery system. Some of the proposals that are more single-payer focused are taking us back to traditional Medicare, which is pure fee-for-service, and that's really a step backward. And there's the whole question of the solvency of the financial solvency of Medicare currently, let alone expanding Medicare to cover more to more people, actually everybody, and then the impact on taxes, which you can see highlighted here, is a significant concern. So there's a lot to unpack in terms of, and a lot of questions employers have, and the subsidization issue is a significant issue. The subsidization of private insurance. Private insurance pays providers anywhere from 100 to 150 to 300% more than what Medicare pays, depending on the market, even within markets. And when you move to a Medicare for All solution, what will provider payment be? And how will that payment affect access, affect the disruption within the delivery system itself, and which could be significant depending on what the level of payment will be. So there are a lot of questions around Medicare for All, and so it's not so much an issue of employers just dismissing it outright. It's more of a question of there are too many unanswered issues on the table for it to be a reasonable consideration at this point.
We also asked here about employer views on Medicare expansion, and you'll see in this slide that slightly more than half employers would be in favor of some type of Medicare expansion, although they're mixed on at which age breaks they think that it should be expanded to. So you'll see 23% believe that it should be expanded to those 50 and above, 9% believe to age 55 and above, and 23% believe for ages 60 and above. So a little bit of mixed reaction there in terms of expansion and at which age break. I think it leads to some of the questions that Brian just mentioned about overall funding and fiscal situation within the Medicare program. Also some questions as to would expansion be offered to those individuals who currently do have an employer-provided health option. So just a lot more, again, in the devil in the details of needing to understand what this would really mean, but general appetite and interest to consider some type of expansion here.
Yeah, and I think that some of the difference in terms of what employers would like to see in terms of expansion reflects the different industries and different companies and the cross-section we have within this survey. So an employer, for example, that has deep research or technology talent that maybe have an older working population, depending on how far you expand Medicare, they're going to be concerned about losing intellectual capital and possibly very quickly losing intellectual capital if it moves out to get health care coverage outside the employer. You have others who question who's going to be eligible, and if my employees are also eligible, to Ellen's point, for Medicare expansion, they worry about adverse selection. Again, when you talk about the Medicare reimbursement being much lower than commercial reimbursement, there's some risk of adverse selection there. And there's also the question of what will be offered. Will it be Medicare Advantage plans or will it be traditional Medicare? Most employees coming out of an employer today are already in some type of managed care network, whether that's a PPO, whether it's an ACO, a high-performance network. You don't have many employees in pure indemnity today, so offering them traditional Medicare and stepping out of a managed environment is probably not optimal either. So there are, again, a lot of unanswered questions about, well, what do we mean by Medicare expansion, and what does it also mean, again, for the solvency of Medicare, financial solvency of Medicare in terms of how this is funded, and what does it mean for the ACA and the public exchanges that are offered today, which are intended to provide that access to people who don't have coverage. So again, lots of questions, more questions than answers at this point.
Okay, we're going to shift gears a bit, and every year we ask employers to indicate what their top priorities are for the coming year. And what you'll see here is the top two are implementing more virtual solutions as well as developing a more focused strategy to address high-cost claims. This is the second year in a row where virtual solutions and implementing more of them has been the #1 priority for employers. That is and isn't surprising to us. On the one hand, it is surprising because we hear from many of our employer members that they are quite honestly overwhelmed by the number of solutions in the market. They're at a point of saturation with all the different point solutions out there. It's no longer tenable for them to manage all of these solutions. They don't feel as though they're effectively engaging their employee populations in those solutions. That is a little bit surprising to see. Despite them feeling that way, they still want to implement more of these solutions. But we understand it because employers feel as though they need to explore every avenue possible to address the access challenges that they hear from their population. Look at some of these solutions, many of which are very valuable in terms of managing chronic conditions. And they're also looking for more personalized ways to message and communicate with their employees. So they're essentially looking to increase the consumer aspects of the solutions that they offer. And what we say is that they're trying to bring health care to the consumer rather than forcing the consumer to find the health care. Anything else there?
Yeah, I think that this also speaks to the frustration employers have with the pace of change within healthcare. When you look at virtual solutions and technology, that is clearly outpacing the innovation that's going on. It's outpacing the underlying delivery system's ability to keep up. And when you're a multi-state employer and when you know healthcare is local, you know that delivery is very inconsistent from market to market. Virtual solutions allows you to implement something that can cut across my population as an employer and provide convenience and accessibility to solutions that everyone can get access to and not just in a particular market. So there is a desire by employers to do something for their entire population. While these do or can further disintermediate or fragment what's being delivered locally because they're not very well integrated locally, they are providing services and filling gaps in the delivery of care today. And we'll talk about what some of those are.
And we're going to talk about the high-cost claimants in just a bit, but I wanted to dig a little bit more deeply into the virtual solutions. We see 63% of employers in 2020 indicating that virtual solutions will have a significant or very significant impact on healthcare delivery in the future. That was up 11 points from last year's finding. And we see the most growth in these solutions in the areas of musculoskeletal and mental and behavioral health offerings. Just taking musculoskeletal as an example, not really a surprise. Many experts would say that physical therapy is the best way to deal with musculoskeletal issues. It helps address chronic pain. It also helps avoid unnecessary surgeries and procedures. But physical therapy is challenging. It's not very convenient. It's often time-consuming and costly. which leads to about 25% of patients not pursuing the recommended course of physical therapy. So where we've seen a lot of development is in the area of virtual solutions to address musculoskeletal issues and essentially provide remote physical therapy treatments so that employees or family members needing those services can access their virtual app. And there are a number of solutions that do this today, and they can seek the physical therapy remotely on site at their workplace if necessary or at home, wherever is convenient for them. Mental health, again, not surprising. We're going to talk about mental health more specifically in just a bit, but there are many challenges related to mental health access in particular, and the virtual solution development in this space is helping address the access issue.
You know, just on mental health, over 60% of the counties in this country do not have a psychiatrist resident there. And particularly in rural areas, mental health is a significant access issue, and virtual solutions can really help address mental health, not only in rural areas, but also for people who are not comfortable going to see someone face-to-face and would rather do something more virtually.
A new area that we wanted to talk about where we're seeing increased interest among employers is what we call advanced primary care strategies. This can take many different forms and shapes, and you'll see here some of the types of examples that would qualify as an advanced primary care offering. You know, Brian mentioned that healthcare is local, and employers are really looking to do things differently to engage their population at the primary care level. Essentially, what these advanced primary care strategies are a movement away from fee-for-service and episodic type of reimbursement to a whole person view of managing that person's health, often also incorporating the social determinants of health that we had talked about earlier. And so you'll see that 49% of respondents either have in place or will have in place by 2020 some type of advanced primary care offering. Just to name a couple here on the slide and to call them out, steered to physician-based ACOs or high-performance networks. While ACOs themselves and high-performance networks aren't necessarily new, where we've predominantly seen them historically is in the hospital or health system type of environment, not so much at the primary care level. So this emergence in primary care ACO and high-performance network is a new trend that we're seeing. We're also seeing virtual care and primary care growing year over year, as well as a number of employers who are looking at directly contracting with primary care in certain geographies as well. So we're going to continue to track this one and expect to see some growth. You know, what's noticeable here is that primary care in and of itself isn't necessarily a high cost to employers, but by extension it is. When you think about the number of people on a plan that primary care physicians touch, it's extensive. And when you think about the impact that those providers have on a person's overall care, whether it be referrals to specialists, prescribing, recommended procedures, labs, hospitalizations, primary care often contribute up to 80 to 90% of our overall cost by extension. So an area of significant opportunity and focus for employers as we look forward. Again, also not new are centers of excellence. Many large employers have been deploying a center of excellence strategy for many years. We see a 27% increase of employers who look to expand their centers of excellence in the coming year, mostly around the areas of musculoskeletal, as we talked about earlier. It's often top of the list of high-cost claimants on an employer's plan, followed by fertility, maternity, mental behavioral health, and substance use. Again, we talked about MSK and orthopedic issues earlier as we were talking about the virtual care solutions, but significant opportunity there for employers to drive employees to centers of excellence when they do need those types of procedures. And again, not surprisingly, given some of the access issues around mental and behavioral health, that employers would be looking for centers of excellence to help with those strategies. And relative to substance abuse, we see quite a lot of fraud and abuse related to destination treatment facilities. And so employers are looking to drive towards quality centers of excellence for substance abuse treatment as well. We've talked about mental health a couple times already, and Brian and I often say there is not a single meeting we host here at the business group in any forum where mental health doesn't come up. It is pervasive. It touches all the work we do. It touches all of our employer members in some shape or fashion, and certainly we hear about it all the time, just in society, generally speaking, as well. Employers have really been doubling down their efforts to address mental health in a number of ways over the past couple of years, and you can see here on the slide they will continue to do so in the future. We've talked about access being a key challenge. Just simply put, there just aren't enough providers to take care of the patient population seeking care, and so many employers are doing a number of different things to try and address that. Some are bringing behavioral health counselors on site, where they have an on-site clinic or near-site clinic. They're staffing them with behavioral health expertise and counselors. Others are looking at building high-performance networks to build out the capability around quality behavioral health providers. And then others are also looking at virtual solutions and resources we had mentioned earlier to help address the access and the privacy issues that some employees have indicated they have. Also, what we wanted to call out here in the center is culture, and an increasing number of employers are looking kind of hard look at themselves and their organizations in the mirror, from the top leadership team all the way down, to say what are they doing as an organization, what could they be doing better, and how could they help break down some of the barriers that they might be unintentionally putting up in terms of an employee's ability to get the care that they need. So they're doing a number of different things here related to anti-stigma campaigns, also doing quite a lot around peer and manager training so that individuals at the workplace can recognize when somebody might be in need of care and know how to direct them to the appropriate resources to seek care.
You know, I would add, I think that what we're seeing around mental health in corporations today is a result of two initiatives that have evolved over time. First, I would say this move from focused on physical health in the more traditional wellness programs of the past to more of a holistic view of the individual. And the difference to me has always been physical health was about identifying your health risks and then a company telling you what you should do in order to address those risks, where well-being is more about putting resources around you to help you address your needs based on what you're prioritizing, what you think is important. So when companies started moving into emotional well-being, you could start seeing the growth in terms of the types of programs, both virtually and on-site, that they started implementing, and these anti-stigma campaigns were a big part of that. The second piece is more tied to where we started, and that more companies view the health and well-being, their health and well-being strategy as an integral part of the workforce strategy. So when you start seeing it coming out in culture, you can see it starting to affect the organization, and this isn't just about a program. This is about more culture. It's more organizationally how we view the health and well-being of our workforce and its role in being competitive and being productive and in producing good business outcomes as well.
Okay, we're going to shift gears and take a look at a slide that you all have seen for a number of years now, and it looks at overall cost trend and per capita increase. What you see here is that in 2020, employers are predicting a 6% increase, and that's before any cost management initiatives, and then a 5% increase once you take into account cost management efforts. Another thing we wanted to call out here is where you'll see the red arrow. In 2018, actual plan costs were 3.6%, which is the lowest that we've seen in recent years. So while that on the surface is a good indicator, it is still alarming because it's higher than wages, it is higher than inflation, and it's just increasing at an unsustainable rate over time. Brian indicated that per capita costs are going to be $15,000 in 2020, so significant when you take a look at it in an actual dollar term. Brian also referenced consumer-directed health plans, and what we've seen here is that there is an increasing shift away from employers offering consumer-directed health plans as their only plan offering. We saw this shift occur for the first time last year, and in 2 years running now, we're down about 14% from 39% in 2018 to 25% in 2020 of employers who will be offering consumer-directed health plans as their only plan options. Enrollment in CDHP plans is still very high. Over 46% of employees are enrolled in those plans, but it's no longer becoming the mainstay to have them be the primary or the sole plan design offering. That's probably for a number of different reasons. One, employers are being responsive and receptive to feedback from employees about wanting more choice, and so they're adding more choice back into the plans. We also know that consumer-directed health plans didn't necessarily result in the level of consumerism that we had thought. We thought when we initially rolled out these plans many years ago that we would have more informed, engaged employees. They'd know how to better navigate the health system, and they'd make smarter choices related to their health. We know that healthcare is just quite honestly too complex for employees to navigate. So despite the best efforts to engage employees through these plans and engage them in more consumerist-type behaviors, that hasn't necessarily resulted. And lastly, and probably most important underscoring this, is that many of these plans, you can see on the timeline here, were implemented back in conjunction with the ACA when the excise tax or the Cadillac tax was looming on the horizon. And many employers implemented these plan designs in an effort to try and mitigate the impact of the excise tax. As we got further down the timeline, that excise tax got delayed. There was talk of it being repealed altogether, and thus you see more employers adding choice back into their plans as well. We've talked about consumerism a number of different times here, both in terms of complexity of the health system to navigate, as well as needing more virtual solutions to help employees. And we see here a couple of different areas where employers are continuing to pursue and provide consumerism resources to their employees. First here is an area around medical decision support and second opinion services, followed by advocacy tools. And lastly, the biggest jump here, from 39% to 60% year over year, around high-touch concierge services. So really, this is an indicator of employers taking a hard look at all the services they offer and trying to overlay them with a concierge service to help employees navigate the solutions, rather than trying to individually navigate each solution when and they need it, but to have a navigator help them understand the broad array of solutions and help point them in the right direction when they need those solutions.
This growth in concierge services is real important, because if you think of yourselves or anyone you know who's tried to access healthcare, the big question is, where do I start? How do I start? Where do I start? How do I identify the right providers? How do I identify the right resources? And even for people who are more involved with the healthcare system and understand healthcare, that is still the fundamental question. In an ideal world, if you had say an advanced primary care model that you're well connected in with, they could provide that steerage and starting point for you. But again, those only exist in pockets today. And as employers roll these programs out, the intent is that this is the place you go, and they will carry you through your healthcare journey and not drop you through your healthcare journey to help steer you to resources, understand your treatment options, where to go for care, and if there's any advocacy that needs to be done in terms of medical bills or whatever, they can handle that as well. So it is supposed to be concierge. And while they're not perfect today, it's very hard to be able to identify all of the best providers in a given market, but they are moving in the right direction, and I think they're a great resource for employees and their families.
The next few slides talk about pharmacy benefit plans, and this was a new emerging area Brian referenced earlier, that high-cost drug therapies are now the #1 concern for employers when they think about their pharmacy benefit plans. The pipeline is looming. There are an estimated 14 new therapies in excess of $1 million each that are on the docket for FDA approval in the coming months and years. Brian mentioned one, Zolgensma, which was approved in May at an overall price tag of $2.1 million per injection for spinal muscular atrophy. Certainly, there is no doubt, and no employer would argue the point, that these therapies are highly valuable for the patient populations for whom they serve. So their concern isn't necessarily about the value of the drug clinically. Their concern is about how can they finance and fund for these medications. When you think about a drug therapy that's over $2 million per injection, and then you overlay that with what's in the pipeline of another 14 drugs at $1 million in excess that potentially could treat even broader patient populations, the question for many employers is just how can they financially fund for these solutions? And is it even viable for their health plan over the long run to fund for these solutions? So what we wanted to call out in the blue box here at the bottom is that 46% of employer respondents to our survey indicated that they would be willing to consider a role for government in helping to negotiate some sort of pricing around some of these new emerging high-cost therapies.
Yeah, and I think that's a reflection of the frustration employers have. Again, I think to Ellen's point, it's not a question of are these good therapies. It's more of a question of what can society afford, not just what can employers afford when it comes to the price tag on some of these. And when we have brought employers together, we have a pharmacy and benefit management committee that comes together and has these conversations, and employers start surfacing questions like, well, dialysis today is picked up through Medicare. Are there certain conditions that should be just based on what they are and what they cost be somehow picked up in a different way than what we're funding today? So it's an interesting question. I think it's one that will be discussed more with employers as well as looking at other options. But this is a big area of concern for employers going forward.
So separate but related, those high-cost claimants are specialty medications, but before those came onto the market, employers already had significant concerns about specialty medications. You now place those high-cost therapies on board, those concerns are even ratcheted up even more so. Employers have placed a significant degree of emphasis and focus on what they're doing to manage their specialty drug spend. And what you'll see here is an increase, a pretty drastic increase, to 59% of employers who are looking at adding prior authorization for specialty medications under their medical benefit. Prior authorization has been in place for many, many years under the pharmacy benefit. That's in place with PBM plans today for many employers. But what is new is to see this in place under the medical benefit. When you think about many of these specialty medications, they're injected. It's done so inpatient or in a clinical setting, which makes them a medical benefit. So employers are looking at their medical plan and adding prior authorization to help manage some of that specialty spend, as well as other things here that you'll see around site of care management and offering some high-touch case management related to specialty medications. Pharmacy supply chain, again, Brian mentioned one of our forums around our pharmacy and benefit management group that convenes, and we've heard for a number of different years the challenges that employers have with the overall supply chain itself. There are a couple areas that continue to be the challenges for employers, which they've taken some steps to address in the past year and will continue to do so in the coming year. The first is around copay card accumulator programs. Copay cards are not new, but they become quite rampant. Drug manufacturers are often offering these cards to individual consumers. In and of themselves, they may not be a bad thing to the consumer, but the concern that the employers have is that there are often lower cost alternatives available, so they would prefer that the employee take the lower cost alternative where possible. And the other concern they have is that these copay cards bypass plan design. And so they weaken the integrity of the plan by not applying to the deductible historically and not applying toward out-of-pocket maximums. So what these accumulator programs do is essentially reverse that. The value of the copay card is applied to an individual's deductible as well as to their out-of-pocket maximum, thereby trying to preserve integrity of the plan design. Relative to the point-of-sale rebates, again, many of our employers have said that they would prefer a rebate-free world, but in the world where rebates do exist, they're looking at bringing those rebates forward to the point of sale so that an individual who is taking a medication that is rebated actually derives the full value of that rebate at the point of sale. Historically, rebates were held by the employer and passed back to all plan participants in the form of lower premiums. This is essentially passing the rebate back to the individuals who are taking those drugs that are eligible for rebate. So just again, wanted to close out. I won't go through all 10 of these in detail, but these were our key insights from the survey. Wanted to also give to our members on the line a little bit of a heads up and a preview of 2 invitations you'll be receiving to upcoming webinars in September, where we will be doing a deeper dive on the survey findings, as well as we'll have 3 employers on each call speaking a bit about their personal perspectives on the survey findings and what they are doing within their organizations to address those. So the first is on September 4th, the second on September 5th at different times to accommodate time zones or scheduling preferences. And with that, we will move to questions in the room here with the reporters. And again, as Brian indicated, if you do have a question, please turn your microphone on and speak directly into it so folks on the line can hear your question.
I had a question about some of the Medicare for All findings, and I was interested that so many employers said that they expected health care costs to go up as well as taxes, when one of the main arguments of pro-Medicare for All people, Senator Sanders, has talked a lot about taxes might go up, but you're not going to have premiums and out-of-pocket costs. What do you think is the reasoning behind that?
Well, I think that, again, it's very aspirational to say that your taxes will go up and will control costs in certain ways, but also give you a richer benefit as well. They don't all work together very well without any understanding of how you're going to control cost or how you're going to drive efficiencies in the delivery system. So I think the concern is if you're going to cover everything, your costs will go up. And without any indication of how you're going to manage the care or ensure that if you're covering more, it's for evidence-based or value-based care, not just covering everything. So I think employers are concerned about how do you actually manage the cost under a Medicare for All scenario. And I think that's real concern because there's no detail on what they would do to do that.
I think the other thing, too, is the subsidization, right, that the private market provides currently, and it's astronomical, the subsidization that happens. So when you remove that, you know, how is care funded? How are physicians making a living? You know, all those things. So you have to kind of follow that through to say you can't take away significant funding source today and assume that there won't be cost increases elsewhere. Yes.
Okay. I'm sorry. I'm Sarah Hansard with Bloomberg Law. Speaking on just that issue that you were just talking about, can you all address in some way the idea that do you believe or do you think employers believe that Medicare is paying too little? Because it was my understanding that Medicare is supposed to be basing what they reimburse based on actual costs, you know, plus some margin for them. And what is the thinking on that?
You know, I think it's a great question. I think providers will tell you that they don't make money on Medicare. They make money on commercial. And I don't have a sense of, you know, I can't really answer that question in terms of whether or not a Medicare reimbursement is a reasonable reimbursement. Again, I think moving out of fee-for-service and moving more into value-based arrangement where there are financial incentives to manage cost in the most efficient site of care is the way it needs to go. I mean, fee-for-service just exacerbates the problem.
Okay. Maybe that answers my question, but you don't think they're mad at paying 250% of Medicare or whatever they're paying? I mean, aren't they willing to say, you know, if that's what providers want to do, maybe we should go to Medicare for All? Any thoughts on that? Maybe they haven't addressed that issue.
No, I think that I think to Ellen's point, if you go to Medicare for All at Medicare rates today, the disruption in the system will be quite significant because of the subsidization that employers are providing today. So if you're paying 100, 150 to 300, 400% in some markets above what Medicare is reimbursing, and you go straight to Medicare for All reimbursement rates, you think about access issues, it would be probably significant. I think quality suffers. I think that's why employers are saying they believe quality will suffer as well. You know, I'll ask Steve, do you have any other thoughts on that?
Yeah, I think as we know, there's always political pressure to raise Medicare rates for hospitals and physicians. So if we moved wholesale to, even if there was a transition period, which I think we would need because of all the capital, legacy capital that would have to be paid for in our healthcare system, there would be tremendous pressure on Congress to raise the rates. So I don't know if any of the Medicare for All proposals factor that in, the political reality of the pressure from providers as more people are covered by a program that's where the government payment is lower than they get in the commercial side.
On Medicare expansion, you mentioned the concern about adverse selection. I guess I was just wondering if you could unpack that a little bit and explain what you mean there.
Sure. So if I offer a government option next to an employer plan, and that government option is based on rates that are a lot lower than my government plan, and certain people within my population move over. Typically, the people who move out of a health plan first are those that are healthier, as opposed to those who are sicker. So if your population, if you're losing healthy people from your population, then your healthcare costs are just going to go up for everybody else. So there's a risk there. They're not sure what would happen because we've never seen that scenario where a public option is offered next to a private plan. But it does raise the question about, will you see some type of adverse selection of movement as a result of that? Yes, Steve.
On slide 17, it looks like the actual plan costs have gone up a lot less over the years than even the estimates for after changes being made to the plan.
Yeah.
So that would seem to indicate that cost increases is not as big an issue, at least for these larger employers, as it might have seemed.
Yeah, there's typically about a point difference if you look at what employers eventually believe trend will be and where trend's been coming in over the last number of years. So if they think 5% is the number, it's coming in around 4 or a little above 4, and then for 2018 a little below 4. And even if you project for what we see projected for 2019 right now may be a little bit below 4 or probably around 4 as well. So why is that? And I think that what you have, working for a large employer myself most of my career, you never want to come over. If you're a self-insured employer, you want to make sure that your costs are either going to be pretty on target or maybe come in a little bit under what you expect them to be for the year. And so there's some conservatism that's probably built into what the belief that trend may be in the year as they're projecting. It's no different than the conservatism, I would say, and probably even lower than the conservatism that maybe a health plan who's providing a fully insured rate would do for a given year as well. So projected trend and actual trend there's been a little bit of a delta between that, and it's been about a point or less than a point of trend over the last number of years as we reflect back and ask employers, well, what did your costs really come in for the prior year? I think there's also some hedging there on, the worry and concern about these high-cost drug therapies that are in the market and what impact they may have on you. Now, you may not get hit by any of those, or you may get hit by one or a couple of those, but if you're looking at $1 million, $2 million therapies, I think that employers are trying to understand what impact that's going to have as these specialty drugs continue to get rolled out, what impact that will have on my population. So there may be a little conservatism there in terms of what they believe trend will be because of that. Yes.
Do you think the administration's decision to abandon the rebate rule will have any impact on employers' plans for rebates going forward?
No, I don't think that the rebate rule as was structured in being proposed was going to be very effective anyways, because it really relied on, from my perspective, the goodwill of then the drug companies to lower their price. And so I'm not really sure how effective that model would have been, even in the Medicare world, let alone the commercial side. So So I think that most employers don't like rebates. They would like to see an alternative to the rebate-driven model. They don't believe that rebates are an effective way for managing drug costs. They add a level of, I would say, opacity to the supply chain model. I think they'd rather see, and you can see in the survey report, they'd rather see something that was closer to more of just a net drug price. And so how you get there is probably easier said than done, given the complexity of the supply chain model. But and I would say that, and this is something we've said before, that the move to high deductible plans by employers is what's put that spotlight on drug price. Drug price has always been a challenge, but it was masked by copays for the consumer. Once consumers were exposed more to drug price, now you see a lot of energy and focus on drug pricing. It's been a challenge for years, but now you see that focus by policymakers, by the media, by everyone on, gee, these drugs cost a lot of money. And so, which that focus, I think, is a good thing. We have to find a way to rein them in. But the supply chain model is very complicated, quite antiquated in terms of its structure, given today's reality, and it's ripe for change. Yes.
So just to follow up on the consumer-directed health plans, high-deductible health plans issue. So I'm just trying to understand these numbers just a little bit, so I'm a little unclear on it. So the number one I see on slide 18 is that median participation rate in CDHPs offered as an option is 46%, up from 35% last year. So that's not saying 46% of these employers' employees are in CDHPs. It's saying the median among them is 46%?
As in the median enrollment in consumer-directed health plans when there's a choice between PPO or a different option that employer is offering, the median enrollment is around 46%. Yeah. So it's not saying that, you know, if you only offer a high deductible plan, then anybody who's enrolled is 100% in a high deductible plan. But when you offer choice, the question's more around what percentage of our population is selecting a consumer-directed health plan over other options you may make available, and that median enrollment is 46%.
Okay, so is this 46% of all employees or 46% of a subset?
It's 46% of employees who are enrolled in a health plan at a company. Okay. Because not all employees enroll in a health plan at a company, right? So right. If, typically you could see 20% of your workforce enrolling in their spouse's plan or, you know, having other coverage options for whatever reason. Of those who enroll, what percent are enrolling in high deductible plans versus other plans?
Okay, and then a couple quick follow-ups on that. So the share mandatory only offering such plans is declining.
Yes.
But the number actually enrolling continues to increase.
Yes.
So I've been hearing in recent years that employers believed that the financial benefit of these plans was maxed out. They weren't planning on pushing them anymore. I'm just curious if you have any sense among record low unemployment, rising wages, and apparently 2018 costs not rising as fast as they were projected to. Those three things seem to be pushing against more people going into high deductible plans. Why is it still increasing?
It's a great question. It's an employee choice issue, so it's really a consumer question as to they're selecting these plans over others. I think partly it's going to be because the premium to join a high deductible plan is most likely lower than what it would be for a PPO or another option. And so if I am if I'm more premium sensitive, I may consider a high deductible plan. Employers subsidize the health savings accounts to a large degree in the neighborhood of, I can remember the number, $600 to $700 per employee, maybe $1,000 for employee and spouse. They seed that, most employers seed that every year into those accounts. So if I'm a healthy person and I'm in a high deductible plan and I'm getting seeding every year, that's growing over time. So I think there are a number of factors, but I can't tell you specifically why we're seeing enrollment in high deductible plans grow.
Okay.
even as employers offer more choice back in.
And one last quick follow-up on that. Any employer responses to that employee choice? The only change I'm seeing that might be related in terms of an employer response is the increasing use of concierge services, but everything else sort of seems static as far as increasing HSA contributions or, other sort of ways to respond.
I think the changes for 2020 are a little more subtle than some maybe in the past, and I don't, you're not seeing big plan design changes. You're not seeing big premium increases for next year. You're not seeing steerage so much. I mean, a lot of employers have tools to help employees decide what plan best fits their needs. So they can model out, what are your healthcare expenses? What did you spend last year on healthcare? And give them a sense of which plan may be better suited for them based on their past healthcare experience. And that doesn't mean an employee is going to select that, but it gives them some information to make a decision. So it's a great question. It's just that without surveying the employees that are selecting high deductible plans over PPOs or other plans, it's hard to speculate on what that motivation is, other than the fact that premiums are most likely lower, premium contributions are most likely lower, and they're getting a savings account contribution. Other than those two things, I couldn't venture a guess. Yes.
I have another question on surprise medical bills, which have obviously gotten a lot of political attention over the past year. You guys didn't mention them in your report. Is this a concern for employers at this point, or is it not as much, and why not?
It is a concern. I think that employers don't want an arbitration solution. Employers want, look, if a hospital is going to allow these providers to practice within their facility, then they should be contracted in-network or agree to accept in-network fees and keep the employee out of the mix or the consumer out of the mix of being exposed to these high-priced bills. Employers do advocate on behalf of their employees to resolve some of those things, and so that's one of the reasons you don't see as much noise on the employer side, but it is still happening. It still does happen, so we want to see a solution that is, if you're an in-network facility, if an employee or a consumer is going to a new network facility, their exposure should only be for what it costs them to be in network, not exposed above that. And some of the solutions being proposed could erode the network structure, go into arbitration, more providers who possibly leave networks. If you make you target the reimbursement too high, index it too high off of something, again, you're eroding the network concept. So look, if you're treating people in network, you should accept in-network rates or something close to in-network rates. And again, Steve, Steve's our policy person as well, so I'll ask Steve if he has anything else to add on that.
Oh, yeah, just to reiterate, I think, and Brenna, I don't have the survey results here, but we did a quick survey of our members probably about 6 or 9 months ago, and 91% have some kind of advocacy on behalf of their employees to either eliminate the bills or reduce the bills to closer to the in-network rates. They have, obviously, processes to pay the providers. And again, these are situations where someone is going in-network, but the hospital is providing a physician to do radiology or anesthesiology, someone that they're not choosing, the patient is not choosing, and then they get stuck with this big bill. The other thing I think you mentioned, your question was, is it a concern? I can't remember, but I think it was about 2/3 of employers, somewhere around there, said it was a big concern for in the survey.
Time for maybe one last question. Yeah.
It seems that employers are indicating they want to increase their virtual services and bring more in, but employee utilization of these programs are low. Are employers indicating how they're going to increase, employees actually using these programs that they're putting in place?
Yeah, I would say a couple of different things. It all depends on what the N is, right? So the patient population that's using those services, you can't necessarily look at the total population. If it's a chronic condition solution, it might only pertain to a certain subset of those. So I think kind of getting the number right is an important starting point. And beyond that, I think there are a number of things that employers are doing. We talked about the concierge navigation solutions, right? I think what we've heard not only from employers about their point of saturation with these solutions is employees just don't know where to start, right? They've got a number of solutions that their employers offer to them, and they don't know which solution to use when. And so these concierge and navigator services really help point employees to the direction, to the right solution at the point in time that they need it, and then doing a lot of personalization to employees about how best to engage with those solutions. So a couple of different things that employers are doing there.
And I think an emerging capability is around predictive analytics, looking at claims data, pharmacy data, consumer data, and trying to ping employees, for lack of a better term, in the moment if the data is indicating that they're at risk for something, and try to put resources in front of them that they may need. You know, most of the times the challenge is that these resources are out of sight, out of mind for an employee. And when you do a communication, you sweep certain people in, and when you don't do those communications, you don't. So trying I think some of these engagement platforms are getting better at personalizing messaging and predictive analytics. It's not where you want it to be yet, but as that continues to get better, you'll see, I think, utilization go up because people will be aware of them in real time.
I think another thing that employers are doing, it goes back to the deferring to their partners and looking for partners to play more of an aggregator and integrator role, is looking at natural points of adjacency across solutions so that it's not a solution in a vacuum, but a solution that's deeply connected and interwoven to another solution in place that perhaps an employee does touch more frequently. So how can they leverage their health plan to embed some of these solutions is definitely an area of increasing interest with our employers as well.
All right. I'd like to thank you very much for your time. And any other follow-up questions, please let us know. We're happy to spend time with you. And thank you very much.
Thank you.
Ladies and gentlemen, this concludes today's conference. Thank you for joining and have a wonderful day. You may all disconnect.